to launch in. All right, well, my name is Tim Otto, and an easy way to remember that is, as my peers in third grade pointed out, some say tomato, some say tomato. So anyway, I know Nate's shaking his head. He's heard that way too many times. I'm sorry. Oh well. So there are three of us on the call, or possibly four, but three on the panel who are all from Church of the Sojourners. We're an intentional church community here in San Francisco. And we've been doing this for a little more than 30 years now. And so we've got lots of stories. And so maybe we'll have a chance to tell a story or two on this call. We live in households. Currently, we have 3 households. We have 2 households of singles, and then we have a household with 2 married couples, and both couples have kids. So that's kind of our context and setting. So just to kind of tell you what's coming up. For some reason, I had it in my head that this was an hour and a half. And then I cleverly actually read the description, and it's only an hour long. And so kind of what we thought we'd do is we have 3 panelists, and we'll hear just briefly from each of them. And then we'll respond to any questions or comments that you have. And we anticipate that that'll probably take 50 minutes or so. And so if you can only hang out for an hour, that's totally fine. Feel free to jump off. Of course, this is Zoom. You can jump off at any time. But anyway, there will be a break kind of at the hour mark. And then in the past, I know that people have found it really helpful to just have conversation and share experiences and kind of have that back and forth. And so around the 50-minute mark, we'll divide into 2 or 3 smaller groups, and you'll have a chance to just talk and converse. And then for anybody who's able to, we'll come back for just 10 or 15 minutes and kind of share a little bit of what we talked about in the smaller groups. So that's the plan for this call. All right, so I'll start out by introducing kind of our 3 panelists. And so one of them is Nate Paquette. And the great thing in community is that sometimes we recognize gifts in people who don't necessarily have a lot of letters after their name. But Nate is one of those people who, I'll just say, loves people well and knows how to walk with people and accompany people, and that love is a thoughtful love, especially in the area of mental illness. He's done some reading recently, and I actually haven't gotten to hear him talk about that too much. And so I'm excited to hear that, even though we live in the same household. So Nate Paquette will be talking with us, and then Renata Browne lives next door, and she's had her own journey with mental health struggles. And I thought she could tell us some about what was helpful in community and what was not so helpful. And I think I've heard a little bit of that, but again, I don't think it's been focused quite that way. So I'm very much looking forward to that. And then I'm your facilitator, and I'm also kind of on the panel as well. And so, yeah, I'll just say that each of us will talk for like 5 to 7 minutes to kind of start things out, and you'll get a little sense of who we are, where we're coming from, what experiences we've had, and then we'll go from there. So that's the plan. So in terms of myself and in terms of mental health, I've I've definitely struggled with being compulsive and tend towards addiction. And one area that's manifested itself in is addiction to porn. And I think that's very much a disease of isolation. And so community has been absolutely crucial to me. A community that points me, first of all, to God, but then a community that connects me with other people. And I think there's a way that community kind of shows us who we are and has helped me learn about myself. And that's definitely been key to me being sober and to, giving that up. And so that's part of my story. And also not only community in terms of Christian community, but 12-step community has been really important to me. Having a sponsor, having groups where I can talk about my struggles and receive encouragement. And sometimes I think that the church could actually learn a ton from the 12-step movement. So there's that. I could definitely talk about that for a while, but we'll move on. So another role I have is I'm a registered nurse. I work for the city and county of San Francisco. I've done that for about 27 years now, both in the hospital and in the home. And about half of our patients have a mental health diagnosis. And so I thought I'd talk just a little bit about both the positive power of labels and also the problem of labels. So very early on, I remember fresh out of nursing school, I had a patient who I was told had borderline personality traits. And I walked into the room and was doing vitals and trying to give him some pills. And he said something like, that night nurse was awful. She did not know what she was doing. And I can tell just from the manner and the kinds of things you've said that you know what you're doing. And, as a new nurse, I felt kind of overwhelmed by my job in general. And so to hear that type of flattery was kind of nice. And I had some issues with that night nurse myself. But the fact that I learned a little bit about borderline and the danger of splitting staff really helped me in that moment realize, oh, this isn't about me. It's really important that we not split staff. And so I think I said something like, oh, I'm sorry to hear that. How's your pain today? And just kind of tried to change the subject and move on. And so actually that was an example of the label, I think, being helpful and kind of giving me a little heads up as to some potential danger that I could fall into. On the other hand, I remember another patient who was clear at the end of the hall, and so whenever he put his light on, I had to walk quite a ways. And he had his light on just all the time. It was like a beacon in the night. And he was also very angry and irritable. I'm afraid that when I gave report at the end of our 12-hour shifts, I'd say something like, oh, good luck with this guy. He's just so angry and irritable. And then one of our counselors came along and she talked to us and said, I think he's incredibly anxious. If you were to kind of help him imagine what's going to happen during his day and be reassuring, and there may be some anti-anxiety meds that would be helpful, that would help a lot. And I tell you what, there was a revolution in that patient and how he related to us. And so, I started giving report in a very different way. I'd say, hey, this guy sometimes can tend towards irritability and anger, but it seems like there's some underlying anxiety. And so make sure that you're reassuring and that, you offer him his as needed medication when it seems appropriate. And, he just became a very different person. And so I realized that there were a couple things going on. One is it was the wrong label. I mean, it was right in a sense. I mean, those were the symptoms, but it wasn't the root of the problem. And I think that can often happen. But also, with those labels of angry, irritable, I think I just kind of held myself back from him and was more reserved and not as generous. And weirdly enough, kind of invited that from him. And so, what I've ended up thinking is that we're all kind of on the spectrum of things. And, like I tend towards anxiety. Sometimes I wake up at 2 a.m. and I can't get back to sleep. And for some folks that manifests as panic attacks. And it's really a spectrum where we kind of move along the spectrum, and there's certain triggers for all of us, and there's certain stressors that send us in one direction or the other. And so, I think of those reports that I gave as a kind of metaphor for community life and how we talk about ourselves to ourselves, how we talk about others to ourselves, and how we talk about others to others. And so, when I just say, hey, watch out, that person's irritable and angry, that's kind of about me. That's about my experience of that person. And yet, in community, I like to think in some sense we're all nurses, we're all healers, we're all trying to love the other person towards health. And so we try and empathetically put ourselves in that person's place and ask questions like, what is the root of this? What is the stressor? What is the trigger? And how do I encourage that person towards the healthy end of the spectrum, just as that person hopefully is looking out for me and encouraging me towards health. So anyway, that has just really struck me as part of my experience. I could keep telling stories about how I've put people in boxes that are really restrictive and unfair, and that I don't think that's ultimately helpful. And that's a danger in community, that we just, well, this person's that. We have this history with this person. And so just the importance of letting people out of those boxes, realizing that we're all on a spectrum, and trying to have that empathy that helps us get to those deep roots. So yeah, that's kind of my initial thought. And at this point, I'll turn it over to Nate.
Welcome, everyone. It's good to see you all. Yeah, my name is Nate. I am, as Tim said, I'm not a professional of any kind. As far as a mental health professional, I have worked in a school with for some behaviorally challenged kids. Currently, I work in our public school system here in San Francisco with people who are with kids who have physical challenges, and along with some mental challenges also. I specifically work with a little girl right now with cerebral palsy, and that's kind of what I do Monday through Friday. And it's been a great week because I've been back in the building with our kids, and that has been a delight to be with our kids in person again. So yeah, I've been at Sojourners for 14 years, I think. And I'm going to piggyback on some of what Tim has said and do some possible repetition there of some of that stuff. But I think I recently read a book that's called Finding Jesus in the Storm, The Spiritual Lives of Christians with Mental Health Challenges by John Swinton. I actually read this with a member and a dear friend of mine who experiences mental health challenges among us. And we read this book together. We have been reading this book together, and I think we both found it to be a really helpful read. I think it has been a helpful read in what John Swinton does. He was a mental health nurse for many years, and he's also a theologian and pastor, and in England, and I think it was England. Scotland, sorry, in Aberdeen, Scotland, and and uh, and he interviewed a lot of people who experience mental health challenges, and so a lot of the book is just hearing their experience, um, and reading their experience from their own words. And I think that has been a really helpful for me, just to kind of understand a little bit more. I think one thing that I've always said is, when I'm when I'm talking with somebody, it's just, I can never say, well, Tim, yeah, I agree with Tim that we're all on the spectrum of some kind with our mental health. And the other times when I deal with depression, but everybody is so different that I can't ever say, hey, I really understand what you're going through, because I can't. And I don't want to pretend that I can. But I do want to listen, and I do want to hear what their experience is. And I think hearing other people's experience, also, of I think the person who read it with me also has found it helpful in just being able to know that they're not totally alone, in those experiences. And so I found that to be really helpful. I'm just going to continue with a quote, that I kind of want to focus our time on, I guess, or my time a little bit. Um, he says this: when our brothers or sister in Jesus struggles to hold on to the great joy of Jesus, other brothers and sisters hold it out for him or her, not in a way that is judgmental. And he says this is the judgmental way of saying it. If you can't feel Jesus in the way that I do, then you are spiritually less than I am. You better work out what sin you have committed. But in a spiritually gentle way that says, okay, for now it feels like Jesus has abandoned you. Jesus knows what it feels like to be abandoned. At this moment in time, you don't feel the way I feel, but I desperately want to help you hold on to the possibility that God exists, and the possibility that God loves you, and the possibility that joy might be closer than you think. I know that's not how you feel, but it remains a possibility, and I want to see you in this darkness as best I can, and I want to say to you that I love you, and that God loves you, and that we can wait together. The storm will pass. Let me hold joy for you for a little while. Like the friends who opened the roof and lowered the paralyzed man down into the presence of Jesus, worship holds open the possibility of God. Holding it open for others is the task of Christian friendship. One of the things that John Swinton says, that I have found really, really helpful, is he talks about the difference between healing and cure. And I think so many times we want a cure, we want people to be better. And I I understand that, and I would like that too. I think people who experience mental health challenges, while I think symptoms can get better, and things can get managed with meds and meditation and all kinds of things. I think there are certainly work that people do in therapy, that can be really helpful. But it seems like most people who experience mental health challenges will kind of always deal with them in some fashion. Um, I think we do pray that God would cure, but he talks about healing and what is healing, and he says that healing is the thing we're looking for, which is three things: reconnection with God, reconnection with yourself, and reconnection with others. Tim kind of already said that, but but I have found that way of framing it as healing and not focusing on just like getting this person better, fixing them, but how do we work towards healing? How do we work towards reconnection with God? How do we work towards reconnection with themselves? And how do we work towards reconnection with others? And I think just briefly, I'll just talk quickly about each one. I think the reconnection with God is really difficult and really hard. I think, as that little quote from John Swinton, I think a lot of people feel abandoned by God, in this, and rightfully so. It feels very dark. It feels, like Psalm, 65, where, I don't have a foothold to stand on. I feel like I'm drowning. And that feels very real. And, for us to be able to sit with them in that is really important. I think one thing that I remind folks of is that this isn't because of their sin. This isn't because of that they have a weak faith, or they haven't prayed enough, or they haven't prayed hard enough, or they haven't tried hard enough. We don't know why always that mental challenges exist, but I try to stress that this isn't their wrongdoing or something. I think there is sin in the world, and I think that's part of our brokenness of the world. But I don't think it's somebody's specific sin, or that their faith is too weak, or that there's demons, or, I think all of those things, I think, can be really dangerous ways to think about it. And in fact, there's a lot of faithful ways to think about it. In fact, there's a lot of faithful people, Jesus himself included, who have felt abandoned by God. And so, yeah. I think reconnection with oneself, Tim kind of talked about this a little bit, but just reconnecting as a full person. Tim kind of talked about this idea that you're not just this one thing, but that you are a full person who contributes. And I think community gives a great opportunity for people to feel like a full person, because people who have mental health challenges have walked with me super well, even in their hard days, and have loved me and have loved others, and we them. And so I think it's a great place that we can all contribute, and that they can feel like they're more than just this diagnosis. And then reconnection with others. I think that this is another place where community can just be a very important thing, of reconnecting with others on a daily basis, in prayer, in sitting with one another in the hard. Knowing that, the stability of community, I think, is really important for people with mental health challenges. Just saying that, we've been around for 30 years. A lot of us, I've been here 14. I'm not planning on going anywhere. And so the stability gives some containment for some folks who just need some stability, and just those relationships. And not that we do it perfect, but that we are continually going to walk with one another, we with them and them with me. I think the beauty of community, like Tim kind of talked about, is it's not, I don't feel like I'm serving those with mental health challenges. I think it's we serve one another in all aspects of our life, and I just think that is huge for reconnecting with others, for being a person, and reconnecting with God. So I'm going to stop there.
Well,
And I believe Renata is going to share next.
Yeah, so just, first off, I'll say I have bipolar disorder. I had an episode 8 years ago where I had a pretty intense manic period, and that was kind of challenging to do in community for everyone else in community, as well as for me. You kind of feel like everyone's watching. But at the same time, community was a very healing place for me afterwards, healing from some of the shame of having gone through that. And then, of course, after the mania, I went through a pretty severe depression, and again, found people at Sojourners to be very good support. So yeah, like just the personal experience with that. I want to come back to labels. I think maybe one of the biggest ways to help someone or walk well with someone is to use person-centered language. So what I mean by that is, it's really hard to hear from someone or hear myself talked about in terms of she's bipolar. No, actually, I have bipolar disorder. We wouldn't want to refer to somebody that, is experiencing, for example, schizophrenia. We wouldn't want to say they are schizophrenic. We would say they have schizophrenia. So being seen as more than my disease is like a really big basic kind of way of respect. Yeah, so speaking in terms of experience, I'm experiencing a manic episode or a depressive episode. And also recognizing, for me, there's a lot of times without any symptoms at all. It's been now 8 years without having any, really any episodes at all. So, but being able still to say, you know, this is something that I have, and feeling respected as a member of the community. Helpful things, like just in practical terms, both separate from community and part of community, you know, treatment, of course, has been helpful. Medication has been helpful. Definitely, those are good things. Just really briefly, a skills-based approach I've found has been the most helpful thing. And so I will share a couple links for resources related to dialectical behavioral therapy, also known as DBT. That was definitely kind of one of the key turning points for me, is having skills to reach for. But just back to the community side of things, being offered opportunities to talk about it, and, you know, maybe someone bringing it up and saying, would you like to talk about it? And, you know, sometimes I would like to talk about it, and other times I'd rather not. And so being given kind of an out was helpful. So yeah, I experienced some good sensitivity around, maybe I do want to talk about it, maybe I don't, you know, kind of processing what happened. Yeah, and that really helped me in my process of kind of healing from some of the shame of it. Another thing that I found helpful while living in community during an episode was, there was one particular member of the community that would take me on walks. And that took the pressure off in a lot of ways. It got us moving. I didn't have to hold a good conversation if my, you know, thoughts were, you know, very distracted or just struggling in other ways. Walks are really a good way of supporting people. I felt very supported by that, at least. And another thing was being invited to things where I didn't have to necessarily hold a conversation, but being able to participate and feel welcome. So that's just kind of like a little overview, a mention of different things, but I would definitely be happy to talk about any of that more in depth. And I will put a couple links in the chat of things I've mentioned.
Renata, this is Tim. Do you want to talk at all about things that weren't so helpful?
Sure. I guess I talked about this more by saying the opposite of it. So yeah, I did experience a little bit of labeling that was not helpful. There were times I felt patronized and seen as only my disorder, you know, not as a full person. So I don't know. That's one way of feeling not supported. Also, maybe sometimes it felt like people were making decisions for me rather than involving me in the decisions. But most of the time, I feel like folks at Sojourners did a really good job. Yes, there were some things that were unhelpful, but, you know, I have, especially in hindsight, a lot of grace for everyone doing the best that they could. But I think patronizing is maybe one of the bigger things. Both Nate and Tim talked about, you know, we're all somewhere on the spectrum. Some of us have diagnoses and others of us don't, but it's all part of the big human experience. And there's not like some people that are better and worse or something like that. But there was sometimes, very rarely, there were times when I felt a little patronized and less than just because of having a diagnosis. And that's somewhat just because of the language. So yeah, person-centered language. I hope that answers the question. Mostly I had a good experience at Sojourners, you know, with yeah, support for mental health.
Right. Well, this is Tim again. As I said earlier, we're going to break up into groups in a little bit to kind of share with each other our experiences and questions. But I did want to take just a little bit of time to especially respond to any questions you have for Renata or Nate. I'm just wondering.
Or Tim.
You can either unmute yourself and ask it or type it into the thing. Go ahead.
I was just saying, or if you have questions for Tim.
Oh. I realize as a host, I can't spotlight myself. So anyway, sorry about that.
This is Barb. Never mind.
Karen, was that you trying to talk to us? It was very echoey, so we missed it. But
So I had it on silent, but my son does raising his hand all the time. It's for school. So the thought that I had was just simply curiosity about how you came to the specific format of therapy. Like, was that like what resource in the community or beyond it led to that? I've actually never even heard of that kind of therapy, but that's not a surprise. And then just in terms of like cost and expense, like how does the community decide how mental health coverage is even paid for, right? Like it's kind of the nitty gritty of the logistics of those kinds of decisions. I think fear about access to mental health or mental health services for me is a reason to have pause about combining finances with a lot of other people or something like that. So that's two questions.
I mean, I could be wrong on our end, but I think, yeah, we do share money. That is part of our life together is sharing money. And so, but I think that most of our people who have struggled with, some of our people I know have insurance that has covered that. So I'm not sure, Renata, if you can talk about yours specifically.
Sorry, this is Tim. We also do have a benevolence fund that we've used. And, you know, that is complex. I would say we've had better and worse experiences with therapists. And, you know, I at least personally am a fan of trying to find someone who is coming from a Christian perspective. But anyway, as a church, we have a fund where we have paid for people to go to therapy. And actually, we just became Mennonite, and they have, through Everence, some money available for that kind of thing as well. So that's another resource. Renata, did you want to talk some about how you landed on DBT therapy?
Yeah, how was it decided that would be the modality? Like, how much was that Renata seeking something out versus the community discerning something? Like, I mean, just mental health is just such a huge thing to trust to community. Like I have a lot of hesitancy.
Mm-hmm. Yeah. I mean, I think I just kind of got lucky on that one. And this was, just to be clear, the dialectical behavioral therapy group that I joined, there was a class that was run by my therapist, a Christian counselor, at a Christian counseling center. So I just kind of, I found that because of this therapist, and it ended up being a really good experience. So it was a class that taught the skills as well as kind of a support group to come back and report, you know, okay, these are the practices I tried this week. This is how it went. That kind of double format was really helpful. The podcast that I put as a link in there, it kind of is nice because it goes through some of the basic skills so that you could get an idea of some of the concepts and some of the things to practice just by listening to the podcast rather than, but you know, if you weren't part of a group. But I think that was probably the ideal way to do it. That's kind of more if you're curious or there's no group in town or you can't afford it or whatever. Not sure if that completely answers the question. Maybe just to say really quickly, the basis of DBT is mindfulness skills, and then also distress tolerance and emotion regulation, as well as kind of some relationship best practices, if you will. But just focusing on skills was really helpful. I don't know, does that kind of cover it or?
Sure, thank you. No,
Sure. Good to see you again, by the way.
I've totally missed reasons to connect. Many of you on this page.
Christina asked a question in the chat. She said, how do you help communities get over fear or assumptions of certain mental illness labels or thinking the worst episodes are how a person always is, and how do we rebuild trust on both sides? That's a really good question. I don't know if I have a great answer. I think education is really helpful. You know, I think reading people's experiences, I think if people are readers, I think things like this book, Finding Jesus in the Storm, it's really accessible. It's quite good. So I think there's that. I think also just having, you know, in your community, you know, rebuilding trust is always can always be a really hard thing. I think if there are if there are simple ways that those people can be givers, can be, you know, if there are simple ways in which people who may have that label in your community of having a mental illness, you know, I think here we just try to change our language partly. We try to use the term mental health challenges instead of an illness, because an illness is, I don't know, it just carries a lot of weird connotations or something. But I think mental health challenges feels like, oh, this is something that we can walk in and that we can deal with and that we can walk together in or something. And I think if there are ways to help, I think it helps both the community and the person to find ways in which that person can significantly give or simply give, and use their gifts in ways, whether that's through art, whether that's through, you know, serving, whether that's through cooking. Like there's a lot of things that people can do that are significant that can really be helpful. And so I think just giving them an opportunity to do those things, and helping them figure that out and helping your community figure that out, I think just helps everybody to realize, oh, this person isn't just the sum of their worst episodes. But those episodes I know can be very challenging on all sides. I don't think it's easy. So I don't know if Tim or Renata have more that they'd like to add to that.
Maybe just to say, one way to build trust is to ask, how am I doing? If that's appropriate to the relationship you have with the person, you know, and how could I support you better? Are there things that I'm saying or doing that are hard for you? And just being a little humble and being willing to hear, actually, I don't feel very well supported by this or that. I think that goes a long way. And that's definitely something that was done for me. There was a, how are we doing? How can we support you better attitude here at Sojourners? So that was helpful.
Yeah, I think there have been things that I thought were helpful that weren't helpful in certain situations. And so I think just being able to be able to ask that question, if it makes sense, of just saying, and even being able to be like, hey, when I said this, or I prayed this, or that seemed to trigger you in some ways, through crying or other things. Like, was that what was going on for you in that? And just being very open. And so, this has been a very much of a learning process for me. And, in living at Sojourners, it's been a learning process in all kinds of ways. And one of those has just been, walking with folks with mental health challenges. And I think part of it is just listening. Part of it is being able to listen well, and to listen and not try to fix, and not try to, I think one thing that I tried to do is to use the word "I hear you" and not "I understand," or so I often use the word "I hear you," like I hear what you're going through, and I don't try to convince them that there's a different reality or something. Like, what I will often do is I think this maybe helps build trust a little bit, is just being able to say, "I hear you." And I also, if there's somebody who struggles with psychosis, for instance, to be able to say, "I hear that that's what you're experiencing." And, then I will say something like, "And this is the reality. This is my reality, that, those things you are seeing don't exist." But I never say, "Oh, those things don't exist. They're, you're just silly to believe that that is there," or something. But just to be able to be like, "I hear you," that sounds really difficult. And then to be able to also tell them my reality, of things. So.
And it's also the question about when folks with mental health challenges are a significant part of the community, how does the leadership self-care? And I think that's just such a tremendous, that's a great question. I'm not sure, I'm not sure we have 3 easy points, but I think one thing is just the biblical rhythm of Sabbath, not only for leadership, but for everybody. At Sojourners, as part of our Sunday, we say, hey, take at least from 8 to 11, we have our worship in the evening, to spend time with God, whether that means reading scripture or being in prayer or reading a theology book or going for a walk by the ocean. But make sure you get that into your schedule. So yeah, sustainability for our individual lives and communities is just huge. And so there are those kinds of biblical rhythms that I think are important. We have had an awful lot of burnout in what we have historically thought of as our pastors group, which was not so much preaching and teaching, but more just like counseling, coming alongside people, encouraging people spiritually. And we realized that we had kind of made those people the problem solvers. And so if somebody was struggling with whatever, we would, basically it was the pastor's responsibility to fix it. And that ended up feeling pretty unhealthy, and there was a lot of burnout in our pastoral group. And so part of what we've done is tried to reimagine pastors as focusing on people's strengths and trying to call out the good. And so what we have them do is meet with everybody in the community. So each month, one person meets with them. And the focus of that meeting is not so much problem focused as it is saying, what are your gifts? How can you grow spiritually? How can you dig into discipleship more? And so that's really the focus. We've tried to make that the focus of the pastors. And then we've tried to make it so that small groups are more the place where people share burdens and where we ask people to be accountable, and so that everybody has ownership of these things, and it's not just a burden placed on 2 or 3 people. And then, I realize this can be controversial, but we do rely a lot on outside counselors and are kind of quick to draw those people in to be kind of primary point person. And so, yeah, we could talk a long time about this, but I think those are our primary ways of trying to deal with that. All right, friends. So we are at our 15-minute mark, and so if you need to go at this point, that's entirely understandable and absolutely fine. Bless you, and thanks for joining us. It's good to see so many of your faces.